Hi, my name is Dr. Fred Sylvester from New Hanover Chiropractic. And again, welcome to this episode of Health Talk. Today we're going to be talking about the foot, right? A little bit of plantar fasciitis.
Yes.
Dave, in your past athletic career and also with you coaching and nowadays and that type of stuff, I would have to venture a guess this is a very common injury that you see in the athletic community as well as just people who are, just the age groupers as well.
Absolutely.
Plantar fasciitis, what is it?
Oh, one of the biggest things, one of the key tell signs of having plantar fasciitis is typically what? Pain first thing in the morning when you put your foot down on the ground, right? Yeah. And then what happens typically as the day goes on and you're walking, that area tends to loosen up. Symptoms start to drop a bit. Depending on how long you're on your foot, guess what? Then symptoms start to creep back up. But typically presentation is sharp pain underneath the heel upon waking and placing foot on the ground.
Who's more vulnerable to this condition too? What do you think? Is it runners? Is it?
Yeah, and that's what I was going to allude to too. Is there are higher risk patients that have this stuff. So high impact athletes, runners, sprinters, long distance runners, trail runners, people that are playing potentially basketball on hard surfaces. Constant pounding on that area is typically what causes that issue. Now, what actually is plantar fasciitis, right? So, our awesome, lovely foot here. So, plantar fasciitis is a fascial tissue that runs from the heel to the toes. It's a thick fascia that kind of creates the floor of your foot. Now, what happens is this tissue can get inflamed due to constant pounding. You can see repetitive motion as running where your toes are going up. You're constantly pulling and stretching in this fascia. This fascia has a lot of pain receptors in it, so as it starts getting injured, it can start creating a lot more pain. The other issue too is this fascia inserts on this bone in the heel here. Constant pulling on that area can inflame that bone, leading to what? Bone spurs, things like that, okay? Like I said, what Dr. Sylvester mentioned earlier, patients that are more subjective to this condition are patients that have flat feet, or overpronate. Overpronate meaning your feet are actually rolling in. So you'll see this with a lot of runners. One of the most important things that runners have to look at doing? Getting good footwear, right? Getting analyzed for gait to determine are they pronating, because if they do, they have a potential higher risk of getting plantar fasciitis. One of the other symptoms that we already talked about too is constant repetitive pounding onto the feet. So jumping, running, right? Long distance runners, sprinters, those conditions. One of the other things that a lot of people overlook is because the pain is always in the foot, is how the calf interacts. The calf tightness is one of the biggest things that I've seen treating over the years that actually help get plantar fasciitis gone for patients. You can work the fascia all you like, but if the gastroc or the calf is super tight, that is changing the biomechanics of that foot.
And honestly, when that tightens on the back of that calf, what's it going to do is it's going to set the toes down, right?
Correct.
And that resting position now becomes not so resting anymore.
Yep. Plantar flexion happens, and then your toes are pointed more, which means you're stepping more off the ball of your foot, which means now you're pulling more into that fascia, which can cause constant irritation to that area. So a lot of patients then ask, well, what do we do at our office to help with that? You're chiropractors, right? All you do is adjust the back and the neck, right? Well, this is where some of our other certifications that we have at this office really come into play. Active release technique or any myofascial release technique is very valuable in this situation, whether it being ART or Graston technique. Everyone's known Graston, right? That's the shiny, torture-looking device tools that we use. The concept there is breaking up those fascial adhesions. Breaking up those fascial adhesions will increase what? Motion, decrease pain, right? Decrease, blood flow, but also help with increasing the healing. The other thing too is what we also offer here is a lot of active rehabilitation, right? So what we are able to do, we can start strengthening the foot muscles underneath, right? We can start strengthening your tib anterior because that muscle counteracts what calf does, right? We already mentioned calf is tight. We can actually give you stretches to release calf, which we will show you here in the near future. Multiple ways to get there, it's just what works best for you. Once again, we do have passive modalities. We have cold laser, which you may see in a previous episode here. We have TENS, vaso, stim, taping, once again, all good ways of passively helping trying to control the pain, and accelerate healing. Okay. So then what we'll do here next is we'll show you some of the easy stretches that you can do at home. If these don't work, feel free, call our office. We'll be able to help you out. So back to some of the stretches you can do. What Dr. Sylvester here has is our towel stretch. Now the focal point of this stretch is trying to find a way to lengthen the fascia underneath the foot. One of the easiest ways you can do this is take a house home towel. Shouldn't cost you much. You already have one at home. What you want to do is you want to try to place this towel towards the ball of the foot. The concept is now anchoring it with your foot. Dr. Sylvester is now able to pull that towel, and what you'll see is a gentle lift of the front of the toes.
Right.
What this is going to start doing is it's actually going to start stretching the fascial planes underneath that area. Now here's the thing, you have to be very careful because this area is very easily inflamed.
Sure.
If you start to get more inflammation, more pain with it, back off the stretch. We have another stretch or a rolling device that we can use, which I'm going to show you next, that may be more valuable for that condition, okay? So if Dr. Sylvester would like to sit here, what we have here is one of our plantar fasciitis balls. We have them here available for purchase. If you do not have one, feel free. You can use a tennis ball. I've seen people even freeze like those 16-ounce, 12-ounce Poland water bottles. You can freeze them, roll your foot on it. You're getting the ice effects as well as actually working through the fascia. So this is a very similar mechanism to how we do our active release or our myofascial release techniques. It's just now you're doing it for yourself. Granted, not as aggressive. Now what you want to do is you want to roll through the ball of the foot to the heel. Now here's the nice thing. You find a point of pressure, or pain, which is going to be probably more located in the inside portion of that heel. You can hang out there for a few seconds and actually roll that area out. Now typically what I tell my patients is kind of like if you're working on a foam roller, is you want to see about 70% reduction in symptoms. Once you're at that point, you want to get off of it because you don't want to overwork it and create inflammation. The whole object here is to reduce inflammation to decrease pain, not to overwork it to make it worse. More is not always best in our world.
Yep.
Cool?
Yep.
One final stretch here was we want to show the wall calf stretch here. So we'll show you that in the next clip here. One of the best stretches here when you have plantar fasciitis type symptoms is getting a calf stretch in. Now calf stretching is very easy to do. All you need is a wall. You can use a curb, you can use a tire, which makes this stretch very valuable. You can do it anywhere you like. The concept and the point of what you're trying to focus on here is trying to get your ball of your foot and toes on the wall. You want to be as close as you can to the wall so you can see as Dr. Sylvester leans in, he is feeling a stretch from the Achilles up into the calf.
Sure.
Once again, this is a stretch, so you're trying to target about 2 repetitions at 20-second hold apiece. Now, Dr. Sylvester has some other mechanisms too where you can start hitting the different portions of the calf.
Bend the knee, and it goes to the Achilles.
Yep. As Dr. Sylvester showed here, bending the knees will get a little bit lower into the Achilles.
And then driving in takes it to the fascia.
Yep. And when he drives his knee inside or medially, he can actually start getting it a little bit more into the plantar fascia as well. So what I recommend is try these stretches. If you're not seeing any relief in the next 24 or 48 hours, what I recommend is please give us a call. There's a lot that we can probably do to help you to get you through this.
Good day and good health.